Okay, next we're moving on to the carpus. It's gonna be a little hard to point in the specific regions since they're so small. We'll start with the proximal row from lateral to medial. We have the scaphoid, which would be located about right here. The lunate, which would be located, in the medial part of the hand. The triquetral, which would be above the lunate, more towards the phalanges, and the pisiform, which is located more to the side of the hand. So next we'll do the distal row, lateral to medial, the trapezium, which is located just below the thumb. Oh, I'm sorry, I'm not zooming in very well. Right here. The trapezoid, which would be right next to the trapezium. So, and then the capitate, which would be more towards the ring finger and little finger, and the hamate, which would be more towards the bottom portion of the smaller finger. So the proximal row, which consists of the scaphoid, the lunate, the triquetral, and the pisiform, those are what bones form the wrist joint, and then the forearm bone that is attached is the radius. So for the last question, it says which bone forms a joint with the pollex. The pollex is also known as the thumb or the big finger, our first metacarpal, and it the trapezium articulates with the first metacarpal, so the thumb, and then the first metacarpal articulates with the proximal phalanx of the thumb. And now we'll point out the 5 metacarpals of the thumb. We have the first metacarpal, the pointer finger, second metacarpal, middle finger, third metacarpal, fourth metacarpal is the ring finger, and fifth metacarpal would be the smallest finger or the pinky. The metacarpals are the actual finger themselves. The phalanges would be the tips of the fingers. Next, we're moving on to the pelvic girdle. First, we will discuss the coxal bones. The coxal bone or the hip bone, it's the large flat bone, and it's constricted in the center and expanded above and below. And then it's composed of the three parts: the ilium, which is right here. That's the and the ilium consists of the iliac crest and the iliac fossa. And then you have the ischium, which would be located right here, and then the pubis right here. So it all connects right here to make the coxal bone. Okay, next is the acetabellum, which is also known as, like, if you want to think of it as the hip socket. It's a cup shape opening on each side of the pelvic girdle, and this is where it's formed with the ischium, the ilium, and the pubis. It's where they all meet, and into which the head of the femur inserts. So we are going to be talking about the pubic symphysis, and this is located right where this line is in the pubis area. It's a condition that causes excessive movement, and it can either be anterior or lateral, and it's an associated pain, possibly because of if your pelvis is misaligned, but it's this is where it would take place, is right down here. So the obturator foramen should be located right here. It's the large opening that was created by the ischium and the pubis bones of the pelvis, and that's where the nerves and blood vessels pass through. The iliac crest, it is the largest bone of the pelvis. The crest of the ilium, or the iliac crest, is the superior border of the wing of the ilium and the superlateral margin of the greater pelvis. Right here. Next is the anterior superior iliac spine, which should be located right about here. It's the bony projection of the iliac bone, and it refers to the anterior extremity of the iliac crest of the pelvis, and it provides attachment for the inguinal ligament and the sartorius muscle. So next is the iliac fossa, and it's the large smooth concave surface on the internal surface of the ilium. So this is the posterior view for the greater sciatic notch in the ilium. So this little notch right here, it's one of the bones that makes up the pelvis, and it lies between the posterior inferior iliac spine and the ischial spine, and the notch contains the sacrospinatus ligament, which then that's what changes this notch into an opening. Okay, now right in here is where the ischial spine is located. It's a thin pointed triangular bone that projects from the dorsal border of the ischium, and it's attached to the gemellus superior. Okay, next is the ischial tuberosity, which would be located right here. They're also known as the sit bones, and there's the sitting bones, if you will. It's a large swelling on the superior ramus of the ischium, and it marks the lateral boundary of the pelvic outlet. Okay, next we will be going to the femur. We'll start with the head of the femur, which would be this large bone right here. It's the highest part of the thigh bone, and it's supported by the femoral neck. Next is the greater trochanter, right here. It's a large irregular shape, and it is located right below the head of the femur. The adductor tubercle on the femur is located right here, and it's the lower extremity of the femur, or the thigh bone, and its insertion to the tendon of the vertical fibers of the adductor magnus. The medial epicondyle is located right around the adductor tubercle, and it's a bony protrusion located on the medial side of the bone's distal end, and it's above the medial. Located above it is the adductor tubercle, which serves for the attachment of the superficial part of the adductor magnus.